So you are the president of India's National Diabetic Research Body.
I am actually chair for International Diabetic Federation Southeast Asia.
What makes a difference? For doctors, same degree. You also have a same degree or other doctors have a same degree. What is the skills or ability will have someone to success in the career or life differently?
It's not like that. I don't say that the success
Different
આપણો છે ને સક્સેસ ની ઘણી વાર મને એવું લાગે છે
definition.
કે આપણે દરેક માણસ પોતપોતાની ડેફિનેશન અલગ અલગ નક્કી કરી કાઢ્યું હોય, રાઈટ? સો 90% લોકો સક્સેસ 3 વસ્તુથી ગણતા હોય, તમારી પોઝિશન, પાવર અને મની. એન્ડ ધીસ ઇઝ વોટ considered to be successful in the society.
Okay.
So somebody is more having money, he is considered to be more successful. Somebody is more powerful, or somebody have a position. Like suppose હું મારા ફિલ્ડમાં ઓર્ગેનાઇઝરમાં છું, ફિલ્ડમાં છું, so you may consider that he is successful. But that's not necessarily successful. I think success story is how you feel yourself satisfied. That makes you more successful. તમે તમારી જિંદગી જી છો આનંદથી કેટલા, આજે હું 50 થી ઉપર થયો, હું મને મારા 30 વર્ષના ડાઉન ધ લાઇન જો, because to get everything or anything you are somewhere unsuccessful definitely.
Right.
તમે ક્યાં ને ક્યાં કોમ્પ્રોમાઇઝ કર્યા જ હશો
Right.
જિંદગીના અંદર to get something more. So somebody had enjoyed their life, that is also success, ના? એવું ક્યાં નક્કી કરવાનું છે?
Right.
અને ભગવાન દરેક માણસને અલગ અલગ પ્રકારનો નેચર આપ્યો હોય, because એને સોસાયટી ચલાવવાની છે, એને સમાજ ચલાવવાનું છે,
Right.
એને કોઈ માણસને સપોઝ કરો કોઈને કેમેરામેન બનાવ્યા છે, કોઈને અહીંયા બેસાડ્યો છે, એટલે he wanted કે this shooting has to be done, otherwise if nobody will be there on that side, who will be here? You
Right.
understand? So it's not like that કે he is not successful or the person sitting in the camera is the only success place.
Everyone have their role to
So
play.
role is given by God and we all are decide કરીએ છે. As long as you are enjoying your life, that is what the success is. You should not have a guilt. પણ માણસને કેવું છે કે whatever you get, the power, money or this, we have always a feeling of that કે મને આ નથી મળ્યો, આ મળી જાય તો વધારે સારું હતું, યા ઓર મળી જાય તો વધારે સારું. હું તમને જોઈને મને કંઈ વિચારે વધારે આવે કે યાર તમે મારા કરતા વધારે સ્માર્ટ છો, તમે મારા કરતા વધારે મેરાથોનમાં દોડો છો, તમે મારા કરતા ફલાણો દોડો છો. I may consider that, I may be jealous of that.
Right.
And you may be jealous of this કે બેચીભાઈ યાર મારા કરતા વધારે નામ છે, મારા કરતા વધારે કામ કરે છે. So I mean it's different, but still mild થોડી ઘણી jealousy જરૂરી બી છે કે નહીં તો માણસ મોટિવેટ ના થાય.
Okay.
આગળ કામ કેવી રીતે કરશે?
To take action.
Exactly. So I mean that everything is required.
So you are more than 27 years managing this field of work. So what have been changed from 2 decades and now in context of patient-doctor relationship in basically in diabetic?
So what you are saying is last 27 years. My practice started in 1997, so it's almost 29 years now. So if you ask me what things has been changed as far as doctor-patient relationship, I will say that doctors had become more transparent.
Okay.
You had become more responsible. Definitely, there is જે પહેલા એવું માનતા હતા કે blindly patient trust કરતા હતા, ગોળ જેવું માનતા હતા. Do you think in 2025 onward we should have a same? Because you have so much communication, knowledge, બધી વસ્તુ સામે દેખાય.
Right.
તો transparency આ યુગમાં બરાબર છે. When you can ask the કોઈ તમારે પોલિટિશિયન્સ હોય આને તમે સવાલ પૂછી શકો, તમે કોઈ એન્જિનિયર હોય આને સવાલ પૂછી શકો, તો કેમ ડોક્ટરને નહીં? So I mean a transparency is good. It is good from the doctor's perspective. It is good from patient perspective. They should understand that they are consumer and they have all rights, right, to understand what therapy is going on. And as a doctor, I also feel કે મારે બધું explain કરવું જ જોઈએ, સમજાવવું જોઈએ, and it is a part of my duty and gives me a lot of satisfaction after explaining the patient all aspect of about his disease and then treating him, making him more transparent. I am more happy for that.
If some doctor or one doctor who's carrying the same belief that no, my job is not too much educated, my job just to write a prescriptions, what would you say to them? What would be your
No,
message?
I don't think, because just writing a prescription, we are not a robotic.
Okay.
It is a doctor's duty is come with lot of sympathy and empathy both. It's like each and every patient is different, and that's the reason I always say that Indians, we are the best doctors in the world. We are not like a robotic world. In US or UK, somebody is just seeing the patients and as per their guideline, He's just writing it. But I am writing as per his socio-psychological as well as financial condition of the patient.
Yeah.
I understand the family of the patient and I try to teach and advocate all the things which are available in the market, and accordingly I educate the patient. So it's not my duty is only to write a prescription. Yes, my prescription should be very, very scientifically strong,
Okay.
medically most
True.
advanced and evidence based, but at the same time I want my patient to understand it very clearly. And in last 25-27 years, you know that medical science is constantly changing
Evolving.
science,
Constantly
evolving science.
evolving, right.
That's the reason we always
So
say that
my-
we are practicing.
My second question is related to that. Medicals or science is evolving every year or all the time. Similar time, doctor effectiveness also improved. However, the result of the diabetic or any disease is not evolving or not growing in that level. So what is missing? Systems or patient?
I mean, we evolve like anything. So if you see in last 50 years, the medical science evolved like anything.
Right.
You will be surprised to know that Second World War was the time when the penicillin was introduced. Right? It was 1939 afterward. And you see in last less than 100 years, more than 100 antibiotics are there and which is giving life to the people around the world. So before 100 years, there was no
Right.
insulin or no even antibiotic. So you think of the time which is in last 70, 80 years, how much we progressed. Before 25 years, when I was a medical student, 30 years before, we were writing only to metformin, sulfonylurea, insulin. Even insulin was of old version.
Okay.
Today we have 15 varieties of different anti-diabetic medication, which is taking care of not only diabetes, reversal, therapy, complication prevention, every aspect of the life.
So it's a diabetic management is a long process. Okay, a patient stay with the years with the doctors. Okay, so what are the systems or process doctors should build so patient don't lose the trust during these periods? That sometimes it's maybe increase, sometimes it's maybe decrease diabetic. So what are
I don't say that patient actually they don't have the trust in their doctor. The problem is it's a lifelong disease with a lifestyle to be modified.
right?
So, you know, a patient always feel, or like suppose if I am patient, as a doctor can be also, the doctor also have a diabetes and obesity, they feel that their lifestyle they could not change over a period of time and they develop some complication or the disease is progressed. So they may have a guilt.
Okay,
They may have a guilt. And sometimes they keep on changing the doctors not because they don't have the trust. But because they don't want to go to the same person. कि अबे वो साहब ने जाने सु के इसके यार मारो control रख दिया हो गया.
जो साहब ने बोला वो मैंने follow नहीं किया है.
Exactly.
What I will say to a doctor.
Right.
So in this case, how follow up with the patient will play a role for outcome. For
So
the
there are a
patient?
lot of digital health communications are now increasing. A patient may not able to come to clinic again and again. Still they can be managed distantly. There are some digital applications which can motivate the patient continuously and they can follow on their own also. They may go to the doctor only 3 months or 6 months or once in a year. It's not like that every time. It's not necessary every time they have to go to super specialist like me. We always say that you go to your primary care physician and once in a year to meet us, that's fine. I mean, not needed that every time you have to come to a super specialist only because the disease is so high that everyone cannot be treated by a super specialist. They have to be treated by a primary care physician.
Good. In your context, what the doctor who is handling diabetic patient, what one thinks he is missing in his consultation, which can significantly improve the outcome in long term?
So, I mean, not in consultation, I tell you,
Where?
if public health policy wise,
Okay.
if suppose government or tomorrow a public health policy wise, if we want to prevent, treat and reverse the diabetes, one very important information is about the exercise and the second is about increasing protein intake. These two things are poorly managed in our country. So people have a tendency for everything to sit. I mean, there is nothing like we have to have a standing culture. I always say that, like suppose both of us are sitting here,
Right.
instead of this podcast can be done in a standing position.
Absolutely
We can
correct.
do in a garden where we can have a lifestyle can be given to these people that this is what the lifestyle.
This
A
is
standing culture will improve that way. And the second is every time whenever we meet someone, every place we have a food habit, giving
Right.
food. હવે તમે આયા છો, બેસો, ચાય લો, નાસ્તો કરો. In that sense, if I can increase intake of protein instead of carbs, these two major changes can think change. So તમે કુકી રાખો ચાયને સાથે, એની જગ્યાએ કઈ પ્રોટીનનો આઈટમ રાખો. તમે જે કઈ ચાય પીવડાવો છો એની જગ્યાએ કઈ પ્રોટીનનો આઈટમ હોય, શેક હોય, પ્રોટીનનો હોય, things will change. સવારે નાસ્તાના અંદર તમારે જે ડોસા હોય કે ઇડલી હોય આખા દેશમાં કે પરાઠો હોય એની જગ્યાએ સ્પ્રાઉટ્સ હોય, which will help. સાંજના ટાઈમમાં તમારે ડેલી કમ્પલસરી દાળ ખાવું is a part of a policy or part of your lifestyle. It can change. So the public health માં બે વસ્તુ यदि આપણો
protein and carb
and exercise.
protein and exercise.
There are.
So a doctor who is starting career right now, what would be your advice to stabilize better way their career in the futures?
One is they should remain scientifically very, very updated.
Okay.
So whatever the information which they are giving to their patient should be very transparent, very, very scientifically updated message they should give to their patient. Number one. Second, they should be very transparent. I mean, there is no doubt about it. But sympathy and with empathy.
Okay.
So, I mean, you have to treat the patient and you have to understand the patient also. Take in detail history. They have come to you with many more things. They wanted to tell you many things. Sometimes a doctor is becoming like robot કે મારે કેવલ તમારી એટલી જ વાત સાંભળવાની છે. એ આવ્યો હોય, એને ઘરની બી વાત હોય, એની ફેમિલીની બી હોય.
He's too open.
That they wanted to talk to you and they want to understand it. In that sense, we will also understand what exactly their need is. It's not that necessary કે તમે કેવલ દવા લખી આપો. એને ખરેખર કેમ કે આ તો લાઈફ ટાઈમ ડિઝીઝ છે ને, જિંદગી ભરની છે.
So in your context, what is the importance of social media will impact the doctor's practice or a career in futures?
Social media is definitely going to help everyone.
Everywhere.
Not just the doctors. It is going to help the people
Right.
who are having
I agree.
diabetes, obesity. They will understand the importance of these issues, definitely. And the electronic and print media. Like Times of India, I'm addicted with Times of India.
Okay.
Like since last 25, 30 years, 35 years. Like every day morning, if I don't see my Times of India in morning in my room, I get upset. I mean, it's my 8:30. I have to go through all the news. So, information which is there in any media is actually going to increase the knowledge of public. People who have, maybe disease or you may say with the health condition. If they know, if right information goes through it, it is definitely going to be useful. And the same way, doctors will also get a lot of benefits because they will also understand that what type of social media messages are going on.
Good. So many doctors say it's not my responsibility or not my job. My job is to just to treat patients. How important?
It's not necessarily. I don't say that, today you cannot say that, my responsibility. Even I will say that my responsibility is also there. બહાર જે કચરો પડ્યો છે એ બી ઉઠાડવાનું મારી જવાબદારી છે. My responsibility, I cannot say that, this is not my responsibility. My responsibility to drive rightly with full, જે ડ્રાઇવિંગના રૂલ બનેલા છે એને સાથે રિસ્પોન્સિબલ બનીને ડ્રાઈવ કરવાની મારી જવાબદારી છે. So I cannot say that it's not my responsibility. So responsibility of every citizen, whether you are a doctor or you are a security guard, everyone have a same responsibility. એ responsibility થી તમે ના નહીં પાડી શકો. પ્લસ એઝ એ મેડિકલ પ્રોફેશનલ જે તમે પ્રોફેશનમાં છો એમાં તમારે ઘણી બધી રિસ્પોન્સિબિલિટી વધી જાય છે. I cannot be like બહાર ઉભો રહીને સ્મોક કરતો હોઉં કે તંબાકુ ખાતો હોઉં. That is my responsible behavior. You understand my point? So that's my responsible behavior. So you have to be responsible for each and every act of your life. It is not like that કે આને responsibility તમે ના કહો ને આને responsibility કહો. That how you take it.
So in your context, like your patients they're with you so many years. Maybe sometimes patients have a 10-year, 20 years with you. How do you motivate patient to stay committed to their treatment? What one or two things you do so patient will stick to your treatment?
I just explain first that why we are treating you. That's very important message we should give. Like simple વસ્તુ કહું તમને, કોઈને ફ્રેક્ચર થયો તો દુખાવો મટી જાય એના માટે આપણે ટ્રીટ કરીએ છીએ. બીજું આનો હાડકો સારું થઈ જાય, એની લોંગિવિટી, આગળ ચાલતા મને અટકાય નહીં, એને પગ લબડેલો ના રહે
Correct.
એના માટે ટ્રીટ કરીએ છીએ. તો યુ હેવ ટુ એક્સપ્લેન ધેટ વાય યુ આર ટ્રીટિંગ ડાયાબિટીસ, વોટ ધ પર્પઝ ઓફ ટ્રીટમેન્ટ,
Okay.
હાઉ ઇટ ઇઝ ગોઈંગ ટુ હેલ્પ યુ. શુગર તમારો કંટ્રોલ આવશે, તમને કોમ્પ્લિકેશન નહીં થાય, તમને હાર્ટ એટેક નહીં આવે, તમારે કિડની ખરાબ નહીં થાય, તમારી આંખ ખરાબ નહીં થાય. These information is very important because patient should understand why he is getting treatment, and then probably he may stick to the treatment. If I say what the benefit you are going to get with your regular walk, what you are going to get the regular benefit with your diet, then he will maybe continue with that treatment.
Like no, I realize one thing. Doctors say I don't have that much time. So they how
You
this
may have educator, you
how
may
this
have
help them to
subordinating
set up a
staff.
demand? Haan,
So
great.
you may have a subordinating staff, you may have educator, you may have a dietitian in your clinic, you may have assistant,
So
you may do mass education, you call 10 patients together and this information you can give together also, not necessarily one by one.
Thank you, doctor, for sharing this valuable insight. As I have a today time constraint, so
Thank
I would
you.
love to have a long, short podcast.
Really,
with you.
I loved it. Thank
So-
you. I may be different slightly, but still.
No. I loved your kind of insight, whatever you have shared, that how the transparency will work and your responsibility to educate patient. It's your responsibility that what outcome patient is going to get, then they'll stick to their treatment and which will bring long-term better outcome.
So as a medical professional, I always feel that, if person with diabetes today getting a complication of kidney failure or eye problem, or he is losing his fit, don't you think, I think as a medical professional, as a organizer, as a head of organization of many of the organization which is running diabetes, it is doctor responsibility. We are the one who is not educating that patient. That's the reason today he had developed a diabetic foot problem. Today he had developed kidney problem. If I would have educated him enough, probably he may not have, or probably it would have delayed.
Great, sir. So, because education, Dr. Digvijay Singh Rathod have mentioned that because of diabetic educations there online, that's why I am healthy today. Otherwise, I could have not been healthy. So, thank you for joining
Thank
this
you.
podcast, and we are happy that you have joined.
Thank you.
Okay, thank you, sir.
Bye.